Hi, my name is Majid Moshifar. I'm one of the attendings at the University of Utah Moran Eye Center. We would like to provide you some information concerning LASIK so that your informed decision concerning this elective procedure is properly made. This informed consent video should discuss with you some of the risks of the LASIK procedure. As you know, LASIK procedure or laser assisted in situ keratomelusis, which has been with us since 1990s, has been a substitute or an alternative to myopia or nearsightedness, hyperopia or farsightedness, and astigmatism. Many patients have enjoyed this technology and have had great results. However, not everyone ends up 20/20 with this technology, and there are patients that have had side effects as a result of this surgery. One of the common side effects of LASIK surgery is dry eye. Many patients will complain of dry eye. Indeed, most patients have the dry eye symptoms for the first 3 months, but after 3 months, the dry eye symptoms will be diminished. Based on our recent survey, the chances of dry eye in the long run is somewhere between 6 to 16%. Most of our patients' dryness resolves with time, but it is important to discuss the risk of dryness with your physician. One of the other complications of LASIK surgery is glare and halo. Even though the new platforms of laser technology has diminished the incidence of glare and halo, there is still 1 to 8% of individuals that can have glare and halo, especially if they have high level of astigmatism or high level of corrections. One of the other side effects that patients may experience as a result of LASIK is flap complication. Sometimes the flap can dislocate, or the edges of the flap can be compromised, leading to what we call epithelial ingrowth. Most patients do not have flap complications, but if a patient has flap complication, it needs to be taken care of expeditiously. One of the other complications that patients with LASIK surgery can experience is usually fluctuation of the vision. Although the fluctuation of vision will stabilize eventually, but there are patients that can have fluctuation of the vision at nighttime or even during the day. Most of the patients' fluctuation to the vision should stabilize by 3 months. Having said that, there are still 1 to 2% of patients that due to dryness or other causes can have fluctuation of the vision. One of the other common side effects of this disease is what we call undercorrection or overcorrection over years. As you know, your refractive error or your correction in your glasses will change with time. So there are some patients whose glasses may still change. As a result, some patients may become undercorrected after several years, or they may become overcorrected after several years. It is very important to again discuss that with your physician so that you know what are your chances to become undercorrected or overcorrected. Most physicians should have a nomogram to tackle this issue, but this is a very important thing to discuss with them. One of the rare complications is infection. The incidence of infection in our institution is 1 in 15,000, but it can be 1 in 1,000 to 1 in 2,000 in literature. More importantly, there is a risk of inflammatory diseases as a result of LASIK. There are patients that can develop inflammation of their flap or inflammation in the flap and underneath the surface of the stroma, which we call sands of Sahara. The incidence of that can be as high as 1 in 100 to as low as in 1 in 2,000. Although the sands of Sahara condition can be resolved over the course of time, but sometimes can lead to loss of best corrected visual acuity. You need to discuss this complication, sands of Sahara or diffuse lamellar keratitis, with your physician as well. One of the rare complications that can still happen as a result of LASIK is keratoconus, meaning the weakening of the cornea. Patients as a result of the LASIK can develop biomechanical instability in their cornea, which may lead to what we call keratoconus. These patients may need to wear hard contact lenses, gas-permeable contact lenses, or even have corneal transplant. The incidence of that is very variable in literature. In our institution, the chances of somebody needing a corneal transplant for keratoconus has been less than 1 in 6,000 eyes, but in the literature it can be as low as 1 in 600 to as high as 1 in 2,000. I think again it's important to talk with your doctor about the risk of keratoconus and needing a corneal transplant. There's a very small chance that patients may develop irregular astigmatism, and that can also lead to the loss of best corrected vision. Although with the new laser platform, it's very unlikely to see that. At the end, there are many other complications that we may not know at this point, and we will eventually learn. It's interesting to see that most of our patients that get LASIK, statistically, there are 98% 20/40 and 70% are 20/20. And when we look at these patients even 10 years out, about 92% are 20/40 and about 50% are still 20/20. meaning without glasses, that they can see 20/20. Having said that, please discuss all of these things with our partners at Moran or other colleagues in this community and get your question answered. We sure appreciate that you listen to this informed consent. Thank you and have a good day.